So here at Spooner Physical Therapy, we have a pelvic health specialty practice throughout the valley that you can go and get help for any pelvic floor or abdominal dysfunction. Anyone can have pelvic floor dysfunction, so it can be men or women. Typically you will see it in women that have had babies, or women as they are getting older, or men as they're getting older, where they start to notice that they're having some urinary leakage or some fecal leakage or even constipation for that matter. It can be anything from pain, so post-surgical, so maybe you had a hysterectomy or you had to have a laparoscopy in your abdomen because the doctor was searching for something that was contributing to your pain. It can be anything from the abdomen down through the pelvis. So I often describe it as you have your abdominal wall that comes in and attaches onto your pubic bone of your pelvis. And then you also have your hip muscles on the side, you have your back muscles, and then you have the pelvic muscles. And so all of these muscles need to be working well together in order to have a well-efficient system. So people who have this unexplained low back pain or unexplained hip pain that they've seen many providers for in the past, well, it can very well be something that's going on in the pelvic floor. It's a great idea to come in before your surgery to get an assessment of your pelvic floor, because the stronger you can go into the surgery, the better outcomes you're going to have after your surgery. So a lot of our treatment is based one-on-one in a private room where you can feel comfortable. We're doing a lot of manual techniques, a lot of education on lifestyle habits. Now, some people who do have pelvic floor dysfunction are not always appropriate for strengthening right away, but we're always trying to teach down training habits, breathing with stretching, breathing with exercises when it's appropriate so that they can go on to practice that at home. So if you think that you might have pelvic floor dysfunction and you want to ask more questions, you can feel free to call any of our locations that treat pelvic health, and we're more than willing to answer any of your questions over the phone. But if you don't feel comfortable talking about it over the phone, you're welcome to come in for a 15-30 minute complimentary screen where we can talk in person about if you might be appropriate for physical therapy.